Hey everybody, Dr. Z here, and welcome to module number 4. In this module, we're going to be talking about and going in depth as to what are your cells telling you. What does that mean? How can we check in blood work what your cells are telling you, and how do we get to the root of type 2 diabetes? How do we get to the root of type 2 diabetes? And I'm going to show you how everything that we've learned up until about 5, 10 years ago has been a little bit wrong. And I'm going to share with you why and how you can take that knowledge so that we can start working together to move you along and to move you forward. Now, so here is the thing. I'm going to share with you my screen today, right here. And so here is a picture of the body, and we know that in 1989, diabetes was discovered. Well, it was discovered that it had to do something to do with the pancreas. And then in 1921, insulin was discovered. Now, with the discovery of insulin, this overshadowed the conversation and the narrative, thinking that insulin was the answer to type 2 diabetes, period. There was not a difference at that time between the two diabetes. Now, so here is a person with type 1 diabetes that they can eat as much sugar as they want, and look what happens. Their bodies cannot take the sugar into the cells, and they're starving. Look at them. I mean, she's cachectic. And that was after insulin treatment. And so it's amazing what insulin has done for many people. Now, the problem is that that is what we thought, that it was like a key in a lock mechanism like this, that in the normal situation, the pancreas was like the factory. And then you would have the cells, and the cells would be like a house. And if you didn't have the key, like in type 1 diabetes, then the glucose could not get into the house. Now, and into type 2 diabetes, we thought that the key was there, but sugar could not still get into the house. The glucose could not still get into the house. But that is, we are beginning to believe that that's completely flawed, because, a person that has type 2 diabetes is usually overweight, is not starved like that lady. So it looks like we need to go from the internal starvation paradigm into an overflow paradigm, meaning that the cells are overflowing with sugar inside and out. And it's only 14 years of insulin resistance in which the body cannot shove any more sugar into the cells, that then and only then you start seeing these high levels of sugar in the blood, and then leading to the type 2 diabetes diagnosis. And as I mentioned, this doesn't look like the girl I showed you that was starving, internal starvation. This is different, and so it's an overflow paradigm. Now, what do we do with this information? So the key is that insulin is an anabolic hormone, and that's just a fancy word for saying that insulin is a hormone that helps you build more, period, in the body. It's a growth hormone, and so it wants to make you feel increase certain things, but most importantly, insulin wants to store and build fat, right? And it does this by taking the glucose and excess glucose and turns it into fat. This is called lipogenesis. So if you're thinking that the old paradigm that we used to have, that you had to eat low fat, if you were scared of that, now you got to listen to this, because sugar is actually getting turned into fat through lipogenesis. But most importantly, not only insulin does that, but it actually activates these three little things right here that actually stop the breakdown of fat. It's like bringing a construction crew and asking to demolish a building. They're not going to, if they're built only to build businesses. It's like asking an architect to demolish a building. He's not a demolition crew, right? And so insulin is a building crew, it's something to build fat. And so that's why when insulin goes up, you have an increased buildup of fat through turning glucose into fat through lipogenesis, right? But if insulin is low, then it enables the body to take fat out of storage and use it for energy. And so that's what we want to tap into. So the root of type 2 diabetes is really insulin resistance. And then the root causes of insulin resistance, of course, there is biological causes. So because of our own composition, there is psychological causes, and then there is environmental causes that go even beyond insulin resistance, but that's going to be another topic for another day. But right now, we know that insulin resistance then leads to prediabetes. And you can be insulin resistant for about 14 years before you become prediabetic. Then we know that type 2 diabetes is the next step. Obesity, belly fat, cardiovascular disease, fatigue, high blood pressure, insatiable hunger, chronic inflammation, and Alzheimer's disease. And I just spoke to a cardiologist yesterday who's at the leading edge of developing a new method of detecting that fat that was created through lipogenesis and that builds up in the heart even years before that. So even before people have any symptoms whatsoever. So that's why it's so important to look at insulin resistance. Now, how do we know if you're insulin resistant? Well, here is a trick. The height to waist ratio. The height to waist ratio is actually correlated directly through another number that you can check in the blood that I'm going to share with you in a little bit. So you can take a tape measuring and measure your height and measure your waist. And if your waist is more than half of your height, then you're more likely insulin resistant. And this correlates directly through blood test. So this is a very, very, very effective test that you can do. You don't even need a tape measure. You can actually take a string and put a string around your belly and then put a string of how tall you are. And if the string around your belly is more than half of how tall you are, then you probably have insulin resistance. And studies show that anywhere from 50 to 70% of Americans are insulin resistant. Now, if we want to go a little deeper, we can actually test for insulin and we can test for C-peptide levels. And the best way to do this is actually to test fast in insulin and fasting C-peptide, because then that allows us to see how much insulin has to be released to manage a certain specific amount of glucose. And at the same time, the C-peptide allows you to see whether your pancreas is producing insulin. And so it allows you to see how reversible this is going to be for you. And how do we test that? Well, it's a blood test. You can check the C-peptide test. Most doctors are trained to only check the C-peptide test when we're wanting to see if somebody overdosed in their insulin or if somebody was trying to hurt themselves. That was the main reason we were taught in medical school to use the C-peptide test. So many doctors don't know to use this test. You have to educate your doctors to be able to do that. And then the insulin blood test. And the insulin blood test is the best one is fasting insulin. Now, you can test these two numbers and create what is called the homeostatic model assessment for insulin resistant. And that's a whole mumble jumble that just means that you take the insulin level and you have the fasting glucose, the fasting insulin, the fasting glucose, and it's a very simple concept, right? How much insulin does it take for you to keep the blood sugar levels that you have? For example, if you have a glucose of 7 and you have 70 and you have an insulin level that is moderate, or normal, then that's okay, right? But if you have blood glucose of 70, but your insulin has to be up in the sky, then you know you have insulin resistance and your HOMA score will be high. And so there is many different ways of insulin resistance scores, but this is one of the easiest one that you can do by testing the fasting insulin and the fasting C-peptide. That way you can put them all together. And so then if you're not getting results, which, because we're going to be working for a long time, this is not a sprint, this is more a marathon. And if things are not working really well, or if those numbers are abnormal, then we have to check for these 5 antibodies. We have to check for the islet cell cytoplasmic antibody. We have to check for the insulin autoantibody. We have to check for the glutamic acid decarboxylate antibody. And we have to check for GAD. And we have to check for zinc transporter. And we have to check all 5, because a lot of times when we ask our clients to go to their doctors and ask for these tests, their doctors will only order 3 or 4 or 1 or 2, but we have to get all 5. If things are not working and we have to, and those lab works that we mentioned, like the insulin and the C-peptide, are not showing that your body's producing insulin, we got to make sure that you're not type 1.5 diabetic or frank diabetic. And so what that means is that I want to show you this little graph right here, which is that most type 2 diabetics, most diabetics are type 2. So if you say, okay, all diabetics, right? Diabetics are type 1, type 2, and everything in between. So type 1 diabetics are only 10%, so it's a lot less. And type 2 diabetics are 80%, and so is most of them. And the other 10% are attributed to genetic defects, enzyme dysfunctions, other problems with your endocrine system. And so some of these are called type 1.5 diabetes. And so that's what's so important for us to check, to make sure that you're within the 80%. Of course, if you look at statistics alone, of course, logically, you're going to fall into the 80%, especially if you're an adult and if your waist circumference is high, then of course, we're going to be able to say, okay, you're very likely type 2 diabetic. And so that's the most important thing today that I wanted to share with you guys, right? And so the most important thing today is to go fill out in Practice Better the worksheet of all the numbers that you got. And if you don't have those numbers, then it's important to work with your doctor to get these numbers. The C-peptide, fasting C-peptide, fasting insulin levels, and I think, and the fasting glucose levels. And so this is so important for us to be able to figure out where you stand with all of this. All right, everybody, that's it for today. I hope you guys have a phenomenal day, and until next week, when we will be releasing module number 4 now. Number 4. All right, everybody, take care. I'll see you later. Bye-bye.